Well, here they are. By the way, for context, we are taping this during Euro Cup 2024, so there's a lot of distraction because one of my guests today is from Turkey, and she believes that maybe Turkey is going to win the Euro Cup. I don't agree. I mean, I think it's going to be
We'll
France,
see.
France or Germany, I think. But it's good to have hope. So welcome back to the show. I was doing my monologue intro and was mentioning that we actually aired the first podcast episode, believe it or not, in November 2022. I cannot believe we are July 2024. So it's fitting to do an update because you both have been leading a lot of efforts pertaining to IMGs. And I really feel it's timely to understand what has happened since then. So let's start with a little bit of an intro, and we'll start with you, Nazli.
Okay. Thank you so much for having us here, and very great to see you both. I'm Nazli Dizman. I'm originally from Turkey, and I am currently HEMONC Fellow at MD Anderson through the ways of postdoc fellowship at City of Hope, then internal medicine residency at Yale.
And I think when I had you on the show, you were still at Yale?
Yeah, I was. Yeah.
All right. And Ziad.
Yeah, so I'd start by saying most importantly, I'm an IMG for the purposes of this discussion. I am originally from Beirut, Lebanon, which is where I did medical school. I went to the University of St. Joseph, did my med school in French. Then immediately after finishing medical school, moved to Boston, spent 5 years total there. I did 3 years of research at the Farborough, then 2 years of residency. I did the short track of internal medicine. And then I joined Memorial Sloan Kettering almost exactly a year ago now as a HEMONC fellow, where I'm single boarding in medical oncology and I'm doing the physician scientist track. So I'll be both in the lab and doing clinical work. And it's been an honor and a privilege to work with Nazli and the whole community on sort of supporting IMGs. But it's definitely not been my main job. I've been busy otherwise too.
So let's just level set a little bit. I want to make sure because obviously I consider myself part of this movement, and I'm also an international medical graduate as well. But certainly I can't take credit more than trying to spread the word and help you however I can help you. But Nazli, how did this all start? Let's just, I mean, like how did this all start?
I think it started through our discussions with Tony and Ziad in 2022 ASCO. Actually, ASCO has been very supportive of IMG trainings for a while. Every year in the trainee and early career oncologist lounge, they do have at least one session kind of exploring the path of the IMGs and also giving them future directions. So I was invited to one of them, and in that year, I think we had several discussions with Ziad and Tony, kind of just trying to find ways to address the challenges of IMGs and create a more structured path for them from their plans to coming to this country till the days that they become early career oncologists, even later times. So while we were discussing, we consulted with the ASCO leadership, and then they suggested us to build a community of practice dedicated for international medical graduates. This was around the summer of 2022, and a few months later, we got it up and running with the support of ASCO leadership. For more context about communities or practices of ASCO, these have been, I think these been built in around 2020s first, with a specific focus on certain subspecialties among oncology, for example, palliative care, geriatrics, and they later evolved into different advocacy groups for different populations of oncologists as well. So we were added as an IMG community of practice officially in early 2023.
But before you did this, you said before even you had the conversation with the leadership, there was effort before that from ASCO?
Has always had one session during the trainee lounge agenda. Within that agenda, they usually have an hour of a session, which is whether a panel in which a few IMG members share their experiences and guidance, or table discussions, roundtable discussions with several IMGs for them to give more guidance and or potentially provide more connections within the community.
And Ziad, when during ASCO 2022, as you started having this conversation with Tony and others, who did you communicate with ASCO leadership? Like, who did you reach out to?
Yeah, there were a few different people. I'd say on the administrative side of things, it was Katie Kuklix. I'm sorry if I'm mispronouncing her name, who's been instrumental and who's been sort of one of the key representatives from ASCO to organize the communities of practice. And so she has been incredibly helpful in sort of putting everything together to organize this. And honestly, the communities of practice, I think, have been in very nice effort by ASCO to allow people to do whatever to explore their interests outside of strict original research and whatnot, but part of the framework of ASCO. And there's been a lot of these different communities of practice. And we essentially took that okay from ASCO and tried to run with it. And honestly, it wasn't us running with it. It was more the community. It was very much a grassroots effort, I'd say. As soon as we sort of launched it and thought volunteers and people to get involved, we saw just an incredible excitement by everyone involved, which I think speaks to the interest and the hunger of people to shed light on this, but also to sort of change some of the structural barriers that people face when trying to become successful physicians in the US when coming from abroad, or at least when having their medical school abroad.
And Nazli, whenever we start a new initiative, generally speaking, you have certain goals you aim to achieve, and you have a timeline. I mean, just generally speaking, what were the top 5 things that the community of practice, which by the way, I participate in some of the discussions on the ASCO board and things like that, but as you started this, what were the top 5 goals, I guess, that you set as you'd like to achieve, and when do you think you can achieve those?
So we started by examining the main challenges among the international medical grads in the US. We started a poll. Now it has more than 200 responders. It's very simple. We asked them what bothers them the most, what is the major problem, the major disadvantage they had. I think that to rank them by the degree of the disadvantage per the respondents, the major barrier was the visa-related issues, travel restrictions, lack of mentorship, lack of research opportunities, and also barriers in getting into the system, finding a research program before residency, or getting into the residency match, which are really challenging for IMG. It's very competitive. So we started by this list, and I think the overarching goal in these years is to raise awareness. We have a very diverse, very supportive community in general oncology and within ASCO. So both international medical graduates and the American medical graduates, they are trying to help each other all the time. So we wanted to raise awareness regarding the visa issues, regarding the lack of research experience and residency fellowship applications. So this would be our main goal in the coming years and forever, actually. For that, we have a few initiatives, right? We wrote a statement paper detailing these problems and suggesting solutions for them. And we do a great deal of outreach using our social media platforms, ASCO's My Connection portal. For the next steps, we wanted to divide and conquer. As Ziad mentioned, the moment that we launched this initiative, we had over 50 or 60 emails from people interested in joining our different committees that we built. And the numbers has increased right now. We have a very large group. So we build communities within our committee, on one focusing on visa advocacy and mentorship, another one about research and publications, because we also wanted to generate data regarding these challenges and then make them objective. The other group that we have in our umbrella is on the program directors. And then the last one is about the community oncologists, and to raise awareness about their struggles, their problems with finding jobs and getting support throughout that process. So now we have 4 committees that are working on different initiatives in their own topics. I think in the 5 to 10 years, as we learn from our community better, and as we see like our strength, we hope that it's all those structural barriers that Ziad mentioned will be overcome, and will make some meaningful progress in them.
And
Ziad, yeah, go ahead.
just to echo what Nazli's saying, I think, when we set out to do this, I don't think we have very lofty goals. I think some of the challenges we face are so great, like the visa situation. I mean, changing the immigration policy in the US, which I don't think we necessarily need to go into, is something that has been incredibly difficult to reform on the federal level, and we had no illusions about how it would be near impossible for our initiative to change those there. So we tried to instead set very realistic goals, achievable goals on the short term, and then and things that we could really say have changed things. I'll give you some examples of that. So for instance, Nazli mentioned the Visa Advocacy and Mentorship Committee. They've been incredibly dynamic, and even before the committee was initially formed, we had organized a sort of a Q&A session with an immigration lawyer, who was very well attended, and the video of that is up on our YouTube page, and where we had an incredible participation by people just to be able to ask questions about how to not change. We're not going to change the whole visa system, but rather help IMGs navigate the complicated visa situations in the US. That's an example. As a follow-up to that, we had an even larger session recently with 2 immigration lawyers that was part of the Visa Advocacy and Mentorship Committee. Again, super well attended, where we had sort of formal questions by the moderators, as well as some questions by attendees, where we covered everything from the different visa types, different waiver programs. Honestly, I thought I understood the visa system. Since after attending that, I was like, oh my God, there's so many ins and outs. And again, we posted that on our YouTube. And so I think there's been an effort to educate IMGs about how to tackle one of the issues that is very difficult to tackle on a federal level or on a immigration policy level, but how to navigate those. And I think that's we're achieving part of that goal there. Another example I just like to plug is the program directors and leadership committee headed by Martina Murphy, who's been just a champion of IMGs, and who is a program director at the University of Florida. They're planning now a session, part of the ASCO leadership committee, with all the program directors to raise awareness for the challenges that IMGs face. So really getting at the problem of how can we make HEMONC programs more accessible to IMGs, and what are the barriers that program directors face to recruit IMGs? And I think that has the potential to really have a massive impact, and can be achievable by the work that we're trying to do.
In your experience as you embarked on this, have you noticed that, Ziad, that there's a lot of lack of knowledge? I mean, to that degree. I mean, and how much of what you are seeing is really, if you can answer this, specific, for example, to oncology versus other specialties? Obviously, we're all oncologists here, and that's really what you can't solve the entire world. But have you started? Are you in the process of cross-talking with other societies and other organizations?
Yeah, those are really 2 questions. I'll take the first one first. Is what is the knowledge base of people regarding this? I can tell you from anecdotal experience, from my own experience, just interacting with folks. I've trained in sort of situations or programs where there are not that many IMGs, right? And at least in terms of trainees, more so in terms of faculty, but less so in terms of trainees. So I can tell you my fellow trainees really had relatively no idea about who IMGs are, where they come from, what process they have to go through, and what challenges they face. And I think, just by my being there, I think there was more awareness, and me talking about it with my peers and my friends, there was more awareness about it. So I think just representation in programs across the country goes a very, very long way, especially in places that historically have not had a lot of IMGs. And so I think, anecdotally, I don't think that there's a lot of knowledge, not only among non-IMGs, but even among IMGs themselves. Like I did one track of Visa, say, or one program, etc. But when I learn about the experiences of others, of other people that have come from across the world, right? A lot of different experiences, a lot of different programs across the country, a lot of different tracks, whether they went through research first, whether they went, like Nazli did their training in their home country before coming to the US, et cetera, et cetera. There's so many tracks and so many different challenges that come with these different tracks that, we all face on an individual level, but don't have a bird's eye view of them. And so I think this community practice has allowed, through this unintended, or I say a side benefit of it, has been just the networking effect of just learning more about our shared experiences, even among IMGs, let alone just disseminating it to non-IMGs. Remind me, your second question was, I'm sorry.
Crosstalk with other societies, let's say
Oh, yeah.
cardiologists, pulmonologists.
That's a really good point. So we started, I'd say, focusing on oncologists, but we're trying to work with the American Society of Hematology as a sort of first step of cross-pollinating our experiences there. We've had also other folks from, different societies reach out. I'd say the closest collaboration so far has been with the folks that are trying to work through the American Society of Hematology. And I'd like to plug Alfred Lee, who I know Nazli is supposed to. He was at Yale when she was at Yale as well. He's still at Yale, and is the program director at Yale for the HEMONC program. And he has been very helpful. And there are a number of folks there that are trying to work with us, and there's sort of both we're the oncologist hat and the hematologist hat that are trying to make this cross-pollination happen. And obviously, we're hopeful. I think the more scale we get and the more interconnectivity we get, the more we'll be able to really impact policy on a longer term level.
Nazli, have you encountered, I mean, as you spread the word and talk to a lot of people on all this, was there ever a sense amongst US graduates, American graduates, and others that maybe the international medical graduates are competing for the same jobs that they feel they are more entitled to, and it's not fair? I mean, have you and I'll tell you context of this because, in a little bit, but have you sensed some of this at all or not really?
Oh, could you repeat your last sentence? It was cutting in.
Like, have you sensed amongst anybody from the US graduates that the IMGs provide a threat to them getting the same job, and it's not really, there's a sense that the US graduates may be less, the opportunities to get the same job now is less because there are more of the IMGs trying to get that same job. Was there ever a sense like this, or is this something that you tackled as, we complement you, we really don't compete with you? Like, was this an issue that you felt it's important to address?
Never in my personal connections or any discussions with my program leaderships while at Yale or at MD Anderson, or during the conferences when we discussed this. Once in a while, we would get spams in our Twitter account, so they would DM us from accounts without any followers. But really, a lot of the American medical graduates who hear about this, they reflect on their experiences with the IMGs, from their trainings, from their oncology careers. So they actually agree with us. I think there's a lot that IMG brings to this system. Not that just in, I mean, let me say it again. There's a lot that IMG brings to the system, from contributions to the research till providing services in underserved areas in the United States. So I think a lot of the Americans, they have worked with IMGs a lot. So we have so many American medical graduate supporters helping us in our initiatives, mentoring our trainees. And for example, my mentor, Monty Paul, who is an American medical graduate, but he has been very closely following our initiatives and offering his help. Again, as Ziad mentioned, Dr. Murphy, who is leading our program directors committee, which is a big amount of time that she spends on it, and she purely volunteers for that because she knows the diversity, the impact, and the change IMGs make in the fellowship programs and more further. I can't say that that I have experienced any negative thoughts from anyone except for the DMs that I mentioned. And it is clear in the United States that access to oncology care is very limited in a very large proportion of the country. So having more IMGs in the system would potentially be helpful in overcoming these access issues in the United States.
And Ziad, a lot of times I feel like, we got a level set to, like when you have a problem, you want to try to have like a control arm kind of thing, right? I mean, to understand, it's like almost when to explain that. So how to explain these problems, are you comparing this, let's say, and again, I'm just throwing something, are we comparing this to, let's say, what are IMGs in Germany or France or England that actually leave, like, the IMG who is not German, who's going to pursue a medical career in Germany versus France versus England versus the US, so we can try to highlight maybe there are problems that are very unique to the US that other countries don't face? Or are you saying, like, how are we, in addition to spreading the word, I feel it's important to compare and contrast, because if anything, it highlights some of the issues. Have you looked at other countries, other locations, or is this on the radar?
I think it's a very good question. None of us have looked at this formally in a formal sort of setting, and I'm definitely not an expert on different systems. But what I can tell you is, coming from a country that unfortunately originally in Lebanon does not have a lot of opportunities locally for medical graduates, people have, from my medical school, gone all over the world to pursue their postgraduate training and work all over the world. So I have friends in many of the countries you mentioned, whether in the UK or France or Germany or Switzerland or Australia or other countries, right? So and we keep in touch often, and so I get to see their experiences on a regular basis. And I can say, thanks to that I am fortunate to have come to the US. I don't want to disparage any of the other countries, but I do feel like in the US there are a lot of barriers, but there's also a lot of opportunities. And I don't think that any of our goals here in the IMG oncologist community is to say that there are unique problems to the US, or that the US is uniquely unfavorable to IMGs, because I don't think that's true, and I don't think that's reflected in the anecdotal experiences that I have from colleagues of mine that are all over the world. But I'd actually approach this from another view, in that the IMGs I don't know what proportion IMGs form in other countries. My sense is that IMGs form a relatively large proportion in the US compared to the other countries.
Do we
Although
know, do we know what's the percentage?
I don't have any data to support this statement.
Oncologists, I think 37%.
Oh yes, yeah, but do you know what else?
2014 data.
Do you know how it compares to other countries, though, Nazli, I guess is
No.
the
So, but 30,
not.
that's an important number. 37%
One-third.
medical oncologists in the US are international medical graduates. That is more than 1/3 of the workforce in oncology. That is really, really, really important. I wonder about other specialties in the US, but that's definitely huge. I want to go back to the visa issue, Nazli and Ziad, because I really feel this is such a huge barrier. I've been a subject of it when I was in residency and starting my career, and I'm sure we all have, where you just really get scared of ever leaving and even going to visit your family members, because you could just lose everything and you just can't come back. So we all know this is a big issue. what are your are you seeing a glimmer of hope? Are you seeing some change? Like, if you solve this, I mean, you will solve probably I bet without seeing the survey, it's probably the top issue that bothers us. So are you seeing, like, what's, what are you seeing there? Are you seeing any glimmer of hope that, if I have a work visa, Memorial or wherever it is, I don't need to go to the embassy every single time to get like a re-entry visa? Are you seeing any of this possibly happening?
So I'll for the listeners, I'll summarize the visa process really quickly. Most of our IMGs come to the United States and start their residency training with a visa type called J1 visa, which is sponsored by ECFMG, and it is a specific institution. It's a very structured institution in the American system that helps navigate international medical graduates through the residency training. So it's sponsored by CFMG. It doesn't cause any burden to the residency program, and it's mostly offered by many programs. The con of this visa, J1 visa, is that the resident who finished training in the United States, they need to serve in an underserved area for 2 to 3 years. There are several challenges that a resident go through because of J1 visa. One of you said is that this visa type needs to be renewed every time you leave the United States, and the renewal could take more than a few weeks. So trainees who don't have enough vacation time, they are hesitant to go back home. So that causes a significant amount of the stress and really increases the distance between the trainee and their previously known social support systems. So this is one big problem. I think in that sense, raising awareness is going to be helpful, and the programs may hopefully understand the challenges related with travel restrictions for IMGs, and would allow them to organize their rotations so that they could go back home and come back after renewal of their visas a few weeks later without interruptions of their rotations. Second visa type is H-1B, which doesn't have any restrictions on travel, doesn't require serving in an underserved area, doesn't require going back home if you don't serve in that underserved area, if you don't waive the 2-year rule. But this visa type is sponsored by the program, could be delayed, so it may delay the initiation of the residency, and it is paid by the program as well. So a lot of the programs hesitate providing H-1B visas. I think for trainees who are interested in working in community practice, J1 visas are reasonable because there are several options, although there are several problems there as well. But H-1B visas, I think, require a little bit more attention from the side of the program directors, because offering them more will give their trainees more options in the future when they finish their residency or fellowship trainings, and hopefully allow them to work in a setting that they would want to work. So that's a problem with multi-tiers, and it's really hard to say that, we're going to fix it, we'll fix it. It is clear that J1 visas are offered by a very structured system and very smooth during the residency for both residency and residency program and the trainee. But I think there are a few things that we are trying to do in the next few years. One, trying to educate the trainees before starting residency and really making them understand the problems with the J1 visa, specifically if they're planning to go to an academic career. And second is to educate the program leaderships to encourage them to offer H-1B visas for trainees who would really benefit from that. And I can't think of any trainee who wouldn't benefit from an H-1B visa instead of J1.
For sure, for sure. So, Ziad, I think you're on that educating people, spreading the word is great. We talked about the immigration mentorship and things of that nature. At the last ASCO meeting, ASCO 2024, you held a session which I feel awful I wasn't able to attend, but I had to actually take my family to the airport and they were traveling overseas. So I look forward to being part of this important session in 2025. What did you guys talk about? What did you come out of that meeting in ASCO 2024 that you're going to be doing during the upcoming year leading to ASCO 2025?
A few things, I'd say. First of all, we sort of formally, I'd say, or publicly had the public launch of our different committees that we already mentioned on this podcast. And so we had launched them already, sort of, but this was I'd say, a public launch where we were able to, each of the committee leaders was able to present on their work to date, as well as the work that they are planning to do going forward. And since then, that allowed a lot more people to get involved. And so I think that was one of the highlights of this. And we've alluded to some of the work that's been done by these committees to date. That was one. Two, as we sort of in the same model that we did in the prior year in ASCO 2023, we had some IMGs at different stages of their career come and talk about their journey to date. So Dr. Alapade came and gave a wonderful keynote lecture about her unique sort of trajectory to date and her incredibly successful career to date as IMG, and really starting from this incredibly humble beginnings to now being a major leader in academic oncology, and sort of talking about how that could happen, and also trying to project to folks that, you know, this is a feasible thing. It goes back to the point of representation among IMGs. You know, it is possible to overcome the challenges that we're talking about and have a successful career in academia if that is the goal. We also had more junior sort of faculty members. We had, for instance, Dr. Rafa Nakash, who gave a very nice talk about the issues he's had, the various visas he's been through, and I think just gives a personal touch to the sort of dry material of talking about various visas and, you know, various letter number combinations that we've become very accustomed to, and sort of gives us a very personal touch about what that means on an individual level and how to overcome challenges and seek opportunities. And we also had panels we had a panel that was, I think, very well received by various IMGs who've been incredibly successful. So, for instance, Dr. Irina O'Reilly at Memorial Sloan Kettering, Dr. Kamal Javari also at Memorial Sloan Kettering, and others who really talked about how they've approached mentorship in terms of being mentored and mentoring IMG specifically, and what to look for. Things like, how do you approach someone when you want to get a research position in the US? How do you approach someone when you say you're already a resident or a fellow and are trying to establish a research relationship? I think those are particular challenges to IMGs who maybe are not used to these interactions at an early level. Maybe they're new to the system and don't know how to approach a mentor. And so those are the types of things that were tackled during the meeting. And I'd say one of the big additional things that were not formally on the agenda, but was really just networking. And there was, you know, maybe 300 people who joined overall for the meeting. We didn't count exactly, but that was my rough count of the number of people who joined. And there was incredible networking there. You know, we had everyone from Dr. Jamie Abram, who's, you know, leads the oncology department at Cleveland Clinic, to people who are still in medical school, all chatting together and talking about how to advance the careers of IMGs. And I think that was the sort of the secret sauce at the end of the day of the session, that it catalyzed these sorts of connections.
And it matters. I mean, it really, really, really matters. I think that we can all identify that one person in our career that has given us an opportunity, right? I mean, the reality is we hold that individual very dear to our hearts, because we know deep down inside that probably our trajectory in life would have been very different had we not been given that chance. And I think we all want to pay it forward. I really feel strongly about that in various opportunities that, similar to that person who's extended the hand to us, we would love to extend the hand to others. So that effort is amazing. Being able to have all of these folks in one room and networking and talking to each other is really great. And if anything, I expect that number to increase significantly. Nazli, if we're going to do this podcast several times, obviously moving forward, making sure we continue to spread the word, and I'll have some ideas for you offline that I can share. But what do you think we'll be talking about next year when we have this podcast again a year from now?
That's a wonderful question. I think we'll take a large amount of time talking about what we've done because we have a lot planned for the next year. As Ziad mentioned, we have a very large crew of leaders and volunteers among the team working on several initiatives. Mentorship, virtual mentorship programs are coming up, more outreach, better options for networking. And we have 2 papers coming out from the group, and we also had an oral presentation at ASCO. So we hope that we're going to be bringing more data to table so that we could find ways to intervene and improve the conditions for international medical graduates. I think we'll be talking about visa issues for so many years. But I think perhaps it's, maybe I should correct myself, visa-related issues, because perhaps 50% of the issues are caused by the type of the visa, but the rest of the 50% are probably actionable and wouldn't require a visa change, but would only require more support for IMGs throughout their trainings to overcome these. What else? And our community oncologist team is growing and growing in an exponential rate. So we really hope to do more in improving the job search for IMGs, either going to come into oncology or going to academia. So we'll probably dedicate some time on job search and early career years for IMG oncologists.
And Ziad, that is key. I think the ability to how do I name it? I think overcome the stigma that sometimes faces IMGs is very critical in the job search, right? I mean, let's face it, reality is that many of these universities outside of the US may not be well known to someone here. So you come in as a graduate from University X somewhere, and you don't know what they teach and so forth. So there's an element of this that I think overcoming that stigma is key. And you know what I love, Ziad, also? I love the fact that you have lots of the US graduates with the IMGs. To me, that shows unity of the society.
Yeah, I fully agree with you that we need to have partnerships with everyone involved, because ultimately what we're trying to do not only benefits IMGs, but I think is hopefully to the benefit of everyone involved, whether that's our patients who are going to be served by a larger talent pool that, the US system can choose from across the world. It's a rigorous process, as I think, are acutely aware, to get into the system in the US. And so regardless of where people are coming from, they're going through the rigorous test, the USMLE tests, to be able to practice in the US, or to be able to even apply for residency or postgraduate training in the US. And I think, that speaks to increasing the talent pool, which serves all of our patients. And I think that is an incentive for everyone to want to partner to improve the conditions for IMGs, but also, just as a matter of fact, a third of the workforce, as we've talked about, for oncology are IMGs. And so, IMGs are part of the workforce, an essential part of the workforce, and often served in underserved areas, or really all over the country, right? And so I think improving the working conditions for IMGs, to allow them to be more productive, more happy in their lives, and to allow them to really work to their full potential, is a critical interest for the whole community, because these IMGs are part of your training programs, they're part of your hospitals, they're your colleagues, they're your mentees, they're your mentors. And so whether you're an American graduate, whether you are a patient, I think it's everybody's interest for everyone to be able to reach their full potential. And so I think I agree with you that having a big tent for everyone to be involved, to improve on these conditions and overcome these challenges is to everyone's interest. And I think that's why, in addition to the wonderful people and the kindness of these people, of the people that are involved, I think that's why we've seen such a good reception even outside of the IMG community and the whole oncology community at large.
Well, look, congratulations to both of you. I know it takes a village, and I know there's a lot of people who are involved in these efforts, but I'm a firm believer they're always required. We need like 2 or 3 champions who can actually take the torch, and does not take away from the efforts of your colleagues who are really helping. But at the end of the day, I think having a couple of leaders who are taking that and taking on the responsibility and the accountability is key. So congratulations, Nazli and Ziad. I really, you make us all proud of the effort that you're doing.
Thank you, Shadi, and thank you so much for incredible support. You've given us your platform twice already, and we hope to be back to tell you more later. And thank you so much for incredible support and your partnership in this effort.
Totally agree. I'll echo what Ziad said. Really appreciate your support and your willingness to spread the word. That means a lot to us, and it's really helpful. I also want to thank ASCO, to be honest, while we are closing this session. Dr. Jamie Van Roen, she's just retiring, has been a great support, and several other very, very big names in the leadership have been supporting us from the day one. So we are very appreciative, and I'm hopeful that we're gonna make more progress in the coming years.
No doubt you will. Thank you so much.